We've seen today the second highest number that Victoria or any state has posted in terms of daily new infections. That is 374 new cases in the state today. So that's the second highest after only 4 days ago when we had 428 in Victoria. And we're still seeing what is, in general terms, an upward trend. We're still seeing the number of cases on an average sort of weekly basis going up, which is not a great sign because we're now 13 days into Melbourne's stay-at-home orders, the stage 3 restrictions. There's clearly some downward pressure on the curve because the rate of growth at the moment is slower than it has been. In fact, it looks like it's more like linear growth at the moment than exponential growth. So that's a very good sign and a very good thing to see. But it might well be that the downward pressure that we're seeing is just not quite enough for whatever reason to really start to bring those numbers down again. So I wouldn't be surprised if the Victorian government, who have already sort of publicly considered the idea that there might well be a stage 4, they may well be thinking about what that might look like and when to roll that out if we continue to see this sort of steady and slow growth. Why are we seeing this? Well, a couple of possibilities. One is that we know there's lots of spread through workplaces at the moment. It could well be that we're actually seeing the community transmission, those unknown source infections, starting to dry up while spread continues in workplaces. Let me show you this. This is the number of community transmission cases we see each day in Victoria. Now, it's a little bit early to say because there's a lag on this. This isn't today's data. We haven't got today's figures, but also this sort of represents the infections from, a few days, even a week or more ago. But what we're seeing is after a few very high days, we've had a couple of lower days. And if I show you the trend of that as well, we are starting to see maybe that it is coming down off a peak. I'm not prepared to say that's a trend overall at the moment, but we are starting to see fewer in the last few days unknown source transmissions than we have, and that's a good sign. That means less chains of transmission going through the community that authorities haven't been able to trace, and it does mean that potentially a higher share of the infections are in workplaces. So that's potentially one explanation of what we're seeing here, and it could mean that we need to see tighter controls in place in workplaces, or perhaps some of the workplaces that are currently trading and people working from the office or the workplace maybe need to stop doing so, and that may well be part of another phase. I don't know what the Victorian government is thinking about, but that's the situation as of right now in Victoria. In New South Wales, we are still seeing small growth. In fact, a slightly smaller number today than we're used to seeing. 13 cases, of which 12 are local transmission. And the good thing there is that they are all tied to known clusters. We don't have any unknown source transmissions today. We have had them in the past few days, and the more of those you see, the more you do start to worry. There are 3 main clusters in New South Wales: the Crossroads Hotel, and that's linked with the Planet Fitness cluster as well in Casula. They're sort of one and the same. 50 cases linked to those locations. We still have 8 in Bateman's Bay. That hasn't grown at all today. That's a nice thing to see. And the Thai Rock restaurant in Wetherill Park, 26 cases now. That's 10 more than yesterday. That's been where the bulk of cases from the last 24 hours have been. That includes 2 parishioners at the Our Lady of Lebanon Cathedral. That's potentially quite a high risk environment where there is the potential there for a super spreading event to have occurred, especially when you consider the fact that the infected people, or one of the infected people, went to that cathedral for 3 separate masses and a funeral over a period of a few days. And so that means there are potentially a lot of people exposed. They've all been directed by New South Wales Health to self-isolate for a fortnight. They've been directed to get tested, but that's not an obligation on them. And so there's a big question about how many people will actually follow through and follow that health advice. There is no enforceable rule that says they have to stay at home for 2 weeks. And that might mean we start to see, as we saw in Melbourne, people who maybe can't afford to take the time off work, not following that advice. There is no hardship payment in New South Wales for people who need to self-isolate because of potential COVID exposure. So big question there, how many potential contacts are following that advice, because there are probably quite a lot of them at the moment.